Did you know that most babies start rolling by 4 to 6 months of age, and that they're going to roll from their belly to their back before they can roll from their back to their belly? Gross motor skills develop in stages, and knowing what to expect at each stage can help support your child's movement milestones. Hi, I'm Dr. Jessica Leland, a pediatric physical therapist and founder of Wobbly Beginnings. I specialize in helping infants and toddlers achieve optimal mobility and reach developmental milestones so that they can gain the confidence to move, play, and thrive. Gross motor skills are our big movements that help us to sit, crawl, walk, run, jump. They are the building of our foundation for mobility and independence. In today's video, we're going to break down the gross motor skills for babies from 0 to 6 months of age. So much development happens in those first 6 months that are our building blocks for how we can move as we become an older infant into our toddler years. In this video, I'll break down gross motor skill examples for babies from 0 to 6 months. In future videos, stay tuned because we'll go through other groups as well. You'll get a clear picture of what movement looks like for these early stages of our development so that you can know what to expect as your child grows and you can know how to help support them. If you're looking for more information about how we can support your child, you can visit us at wobblybeginnings.com. So let's start with our brand new newborn babies from 0 to 4 weeks old. One of the big positions that we first will look at is what does the baby look like when they're on their belly? And when you place a newborn baby on their belly, we should see that their weight is shifted forward onto their shoulders and onto their face, and that they should be able to rest with their head turned down to either side. We should see that their back is rounded into what we call flexion, and we might see that their hips are turned out and then tucked up into our sides. You may see an infant when they're lying on your chest at this age from 0 to 4 weeks, you may see them start to lift their head and put it back down. They may lift their head and put it back down. And that's the very beginning signs of head control and starting to develop our head controls. It's going to be easier for an infant when they're lying on your chest to lift their head up and put it back down. And we start to see that lift sort of come more towards the end of that 4 weeks. When we look at what a 4 to 8 week old infant can do when they've been placed on their belly and given time to adjust this position, we can see that their weight, which was really much over their shoulders and to their face, has shifted to more over their chest. You may see them more confidently start to lift their head and turn it side to side. You may see them start to push on their forearms a little bit. You may see them, for very brief moments, you may see them really lift up that head up to about 45 degrees. When we place our 2-month-old on their back, we're going to start to see some spontaneous movement of their arms and their legs against gravity. They're going to be kicking, and you might see both arms kind of moving at the same time, and it's not fluid control at this point in time. We should see that they can be able to easily turn their head from side to side. We want to see those hands start to open and close. We may start to see those hands come to mouth. We may start to see our legs kicking one after the other, so reciprocal kicking. And we might even start to see the beginning signs of our arms starting to bat at things that are hanging above us. A newborn that is placed on their side with support may start to bring those hands together and may bring those hands to mouth. They may start to look up a little bit at things that are placed slightly above their head. As we move on to what does our 3-month-old look like on their belly, we should start to see improved head control. We should start to see the duration that they can lift that head up for longer periods. So as they lift that head up, they can sustain it. It's not just a quick, I lifted it up. I'm really tired. I got to put my head down. We should start to lift it up. We should see them starting to lift their head from 45 to 90 degrees. And we should see that head being able to maintain midline. If we're not seeing that head, think of like nose in line with our chest bone or sternum. That's a good way to kind of tell, are we maintaining midline? Or are we sort of seeing that we're, dipping one as we're extended? Are we bringing one ear to one shoulder more than we'd like? Are we bringing the other ear to the shoulder? Do we always stay rotated to one side or looking to one side and we have a really hard time looking to the other direction? We're starting to see some of those asymmetries, it's a good idea to start to have conversations with your pediatrician or reach out to a knowledgeable infant provider. When we are starting to see, as we're coming along that 3-month, when we start to really rotate that head, we should start to see the infant be able to shift their weight. Their arm should be more forward. Instead of their arms tucked behind us, we should start to see those elbows a little bit more tucked forward. And we're going to start to see them shift their weight. That weight shift is an early sign that we're getting ready to start to kind of know where our body's kind of going in space. And that is sometimes like what I like to call like a little indicator that, yeah, we're working towards that skill of being able to roll from our belly to our back. When we're looking at a 3-month-old that is on their back, we're going to start to see a lot more symmetry in how they're moving their arms, how they're moving their legs. We should be able to see them hold their body in midline. We should really start to see them reaching those arms and reaching for toys or swatting at toys, and we are going to continue to see that reciprocal kicking. One of the things that we start to also see around this sort of 3-month mark is we might start to see some transitional movement. So we may show some signs that we're able to go from our back onto our side. You may occasionally see some accidental rolling coming in where they go from their belly all the way to their back, especially if they all of a sudden were really looking at something and it really caught their attention. They really turned, they really shifted their weight. That weight of their head just pulls them over into that accidental roll. That lays our foundation for our rolling skills from belly to back. You may start to see some purposeful movement at this age, being able to initiate from their back into side lying. You may also see them, if they are placed in side lying, you may see them start to be able to initiate that roll onto their back. By 4 months on our belly, we should see a lot more head extension and we should start to see a lot more chest extension. We want to see them starting to weight bear onto their forearms, and we really want to see that head held up to 90 degrees. We want to start to see them kind of shifting their weight from side to side. We may even start to see a little bit of pivoting, and we should show some signs of like starting to get that arm out, starting to want to grasp for toys and maybe bringing it in. A 4-month-old on their back. One of the things that you might start to see your 4-month-old doing is that they might start to tuck that chin and lift it off of the floor. And that is showing good neck strength. The other thing that we should start to see is that as they're lifting their legs, we should start to be able to lift those legs and knees off the floor to about 90 degrees and starting to come a little bit closer so that we can bring our hands to our knees. And we may start to bring more fluently toys and hands to our mouth. We may be able to start to hold a little bit bigger toys and bring them to our mouth. Side lying is a great position that we can put our young infants in because it brings so many excellent benefits. So some of the benefits when we put our child in side lying is that we can get visual feedback, we can get some vestibular feedback as we move them into that. We get a lot of movement within our frontal plane. It's easy for us with the assisted gravity to bring our hands to midline, to start reaching, and start to work on some anti-gravital strength for our upper extremities. And it gives a different sense of proprioception feedback into our bodies. And our proprioception feedback is one of the systems that we use to help kind of identify at our joints where they are in space. Side lying is a great developmental position that sometimes can be forgotten as a position that we can put our infants in. As infants start to reach this 4-month, they may start to put themselves in this or may start to get themselves out of that position. Around 4 months, you may start to want to bring your child into sitting. They're still going to require a lot of stabilization from like using their shoulder blade muscles and their neck muscles. You may start to see infants starting to prop sit with their hands down, possibly with their hands fisted, and they may still be very rounded through their spine. We should start to see as we get stronger, more extension through our spine, and that shows that we have increased control. A newborn that is sitting and prop sitting is going to be very wobbly. They're going to be very easy to lose their balance to the side or to their front. And so we want to still continue to support them by putting pillows around them so that if they do lose their balance, they have a soft landing. One of the things that helps them is their balance reactions. And so as they're losing their balance, they're gaining that feedback to help them develop those balance reactions. But at that point, we wouldn't expect them to start to have their protective reactions, which is when we start to fall forward, oh, we're going to put our hands down or we're going to fall to the side. We're not going to practice standing with our 4-month-old, but we are going to look at, do they take full weight on their legs and do they have their legs extended? Can you maintain while holding them above their arms? Do they have good head control in sitting versus standing? And that just gives us feedback on how our child is doing it. If we're getting, to 4 months and we're not starting to put weight, we want to start keeping an eye on that. So let's jump ahead to 6 months, because between 4 and 5 months, we're really gaining a lot of that skill and strength on our stomach. We should really start to see our infants between that 4 to 6 month become purposefully rolling from their belly to their back. So at 6 months, we're starting to see that they can start to really reach for toys when they're on their belly. So a 6-month-old on their belly should be starting to reach out for toys. They should be pivoting. They should be able to turn themselves at least a quarter of a degree, if not a full circle, trying to get a toy when they're on their belly. They should be really pushing up on just straight arms to try to move their body. So let's look at a 6-month-old on their back. A 6-month-old on their back should be definitely bringing hands to feet, and they should be holding their feet. They should bring both hands to feet, and they should be able to bring those feet all the way to their mouth. They should start to see that their bottom's lifting up off the surface, and we should see a strong variety of movement when they're on their back. Are they reaching for toys? Are they trying to roll themselves onto their side? Are they reaching from one side of their body across to the other side? Are they reaching across midline? Those are great signs that your infant is really starting to move and explore their environment. When we have a 6-month-old that is sitting, we might still be a little bit unstable when we sit more in like a ring sitting position. So when we bring those knees tucked back in, we might still see a little bit more wobbly, but we should be able to start to hold ourselves up a lot more erect and upright, and we should start to see those protective reactions starting to emerge in there. They won't necessarily be there, so we still might lose our balance and still need a soft surface to land on. We may not always see those hands coming out to front or back or to the sides. When we're looking at transitional movements, and transitional movements is how is our baby getting from one position to the next. At 6 months, we should be seeing rolling as part of our movement vocabulary. We want to be starting to see our infants exploring, whether they're rolling to get to a toy across the room, whether they are pivoting to get a toy that is behind them. Those are part of our movement vocabulary at 6 months of age. We may start to see the signs that we're going to be getting ready for crawling, which comes a little bit later, but signs that we're going to start to build the strength necessary for crawling is that we may start to see them tuck on their belly. They may start to tuck their knees up underneath. They may start to tuck their knees up and push up and coming onto a hands and knees position. You may start to see them push themselves backwards, and you may start to see even some army crawling where they're kind of reaching and pulling forward with their arms, or maybe they get up in that hands and knee positions and then they launch themselves forward. And they're using this as part of a technique for some forward locomotion. As they're getting onto that hands and knee position and they're playing with that, you might see them push onto their toes into like either a baby plank or like a baby down dog position. We may see them as they're up there, they start to maybe wiggle their bottom one side to the other, and we're getting some pelvic rotation. As we're getting that pelvic rotation, that is showing us that we are starting to get ready to be able to move from our hands into our knees into a sitting position. In sitting, as we start to emerge the ability to get those hands down, we may start to be able to see them kind of fall onto their bellies and ease into that transition. And so those are some of the transitional movements that we're going to see at about 6 months of age. A baby that has been put in standing at 6 months of age should be able to hold their head and trunk in line with their body, and we should have full head control. We should be able to take full weight onto our legs, and you might even see if you try to place them at a surface, they might start to have an emerging ability to stand at a surface. Again, it's not a skill that we're going to start to really practice with our infants at 6 months, but it gives us a good idea of their strength, because if you have a 6-month-old that is not taking weight on their feet, I encourage you to reach out to your pediatrician to discuss that, and then also reach out to a knowledgeable provider. Watching your child develop new movement skills is exciting, and every child progresses at their own pace. If you found this video helpful, be sure to like and subscribe for more pediatric physical therapy insights. If you have concerns about your child's gross motor development or just what to expect on supporting their movement development, we're here to help. At Wobbly Beginnings, we offer developmental wellness services. Wellness services are great for parents who want to be proactive and support their kids with their gross motor milestones. You don't have to have a child with a developmental delay to work with us. You can visit us at our website at wobblybeginnings.com. Thanks for watching. I'll see you in the next video.